2/3 of the weight lost on GLP-1 medications may return after treatment is stopped. Here's why that happens, and what you can do about it. Stopping Ozempic does not mean you failed. It does not mean you lack discipline, and it does not guarantee that you will regain every pound you lost. People stop GLP-1 medications for many valid reasons. Some lose insurance coverage, or can no longer afford the medication. Others experience side effects such as nausea, vomiting, constipation, diarrhea, or abdominal discomfort. Some reach their goal weight and wonder whether they still need treatment. Others may need to stop because they are planning a pregnancy, preparing for a medical procedure, or managing another health condition. In this video, we will look at what research shows can happen after stopping Ozempic, including changes in weight, appetite, blood sugar, and metabolism. We will also discuss practical strategies that may help you maintain your progress. This video is for educational purposes only. Do not stop Ozempic or any diabetes medication without first discussing it with your healthcare provider. Let's start with the weight regain data. In the Step 1 trial extension, adults with overweight or obesity who did not have diabetes received semaglutide 2.4 milligrams or a placebo along with lifestyle support. After 68 weeks, participants taking semaglutide had lost an average of 17.3% of their starting body weight. The treatment was then stopped. During the following year, those participants regained an average of 11.6 percentage points. In other words, they regained approximately 2/3 of the weight they had lost. However, they did not regain everything. At the end of the follow-up period, the group was still an average of about 5.6% below its original starting weight. Another study, called Step 4, showed a similar pattern. Participants first received semaglutide for 20 weeks and lost an average of about 10.6% of their body weight. Those who continued semaglutide lost an additional 7.9%. Those switched to placebo regained an average of 6.9% between weeks 20 and 68. These numbers show that weight regain after stopping is common. But they are averages, not a prediction of exactly what will happen to you. Some people regain quickly, others regain gradually. Some maintain a significant portion of their weight loss. Your outcome may depend on your starting weight, medical conditions, muscle mass, activity level, eating habits, sleep, stress, genetics, and the support you receive after treatment ends. One of the first changes you may notice after stopping Ozempic is the return of appetite. Ozempic activates GLP-1 receptors that help regulate hunger, fullness, digestion, and blood sugar. While taking the medication, many people feel satisfied with smaller meals. They stay full longer, experience fewer cravings, and think about food less often. When the medication is stopped, those effects gradually wear off. Semaglutide has a half-life of approximately 1 week. This means it may take about 5 to 7 weeks for most of the medication to leave your body. Because of this, appetite may not return immediately after your final injection. Some people notice increased hunger within the first few weeks. Others may not notice a major change until a month or more has passed. You may become hungry sooner after meals. Portions that once felt satisfying may no longer keep you full. Cravings may become stronger, and the constant thoughts about food, sometimes called food noise, may return. This is not usually withdrawal in the way we think about withdrawal from an addictive substance. It is the gradual loss of the medication's appetite-regulating effect. The return of hunger is biological. It is not a character flaw. Blood sugar changes are especially important for people with type 2 diabetes. Ozempic helps lower blood sugar by increasing insulin release when glucose is elevated, reducing glucagon, and slowing digestion. When Ozempic is stopped, these effects gradually decrease. Your fasting glucose may rise, your blood sugar after meals may increase, and your A1C may begin moving upward again. The amount of change depends on your diabetes severity, physical activity, food choices, and whether you take other diabetes medications. If Ozempic has been doing a significant part of the work in your treatment plan, stopping it without a replacement strategy could lead to poorly controlled blood sugar. Before stopping, ask your healthcare provider whether another medication will be started or adjusted. Ask how often you should check your glucose and when your A1C should be repeated. Possible symptoms of high blood sugar include unusual thirst, frequent urination, fatigue, and blurred vision. Now, let's discuss metabolism. Stopping Ozempic does not destroy your metabolism. However, weight loss itself creates biological adaptations that can make maintenance difficult. After losing weight, your body is smaller and generally requires fewer calories than it did before. If you lost muscle along with fat, your daily energy expenditure may also decrease. Weight loss can also affect hormones involved in appetite and fullness. Hunger signals may become stronger, while fullness signals may weaken. Your body may respond to weight loss by encouraging you to eat more and conserve energy. Ozempic helps counter some of these signals while you are taking it. Once the medication is removed, those underlying biological pressures may become more noticeable. This is why maintaining weight loss involves more than willpower. The good news is that you can take steps to improve your chances of maintaining your progress. The best time to create a maintenance plan is before your final dose. Start with structured meals. Do not wait until you are extremely hungry to decide what to eat. Intense hunger can make portion control more difficult and increase cravings for highly processed foods. Build meals around protein, fiber, and minimally processed foods. Protein helps support fullness and preserve lean muscle, especially when combined with resistance training. A common protein target during weight management is approximately 1 to 1.2 grams per kilogram of body weight per day. Your needs may be different depending on your age, medical conditions, and kidney function. Speak with your healthcare provider or a registered dietitian before making major dietary changes. Good protein sources include eggs, Greek yogurt, cottage cheese, fish, chicken, turkey, tofu, beans, and lean meats. Fiber can also help meals feel more satisfying. Include vegetables, fruit, beans, lentils, and whole grains as tolerated. Hydration matters too, especially if constipation has been a problem. Exercise should also be part of your maintenance strategy. Resistance training is especially important because it helps preserve or rebuild muscle. Aim for strength-based activity 2 or 3 times per week, depending on your health and ability. This can include weights, resistance bands, exercise machines, or body weight exercises. Walking, cycling, swimming, and other cardiovascular activities can support heart health, blood sugar control, and weight maintenance. The goal is not to punish yourself with exercise. The goal is to create a routine you can maintain long-term. Monitoring can help you identify changes early. Consider weighing yourself once or twice a week under similar conditions. A change of 2 or 3 pounds may simply reflect water, sodium, hormones, or digestion. But a steady increase over several weeks may be a signal that your plan needs adjustment. Sleep and stress also matter. Poor sleep can increase hunger, cravings, and fatigue. Chronic stress can increase emotional eating and make meal planning or exercise more difficult. Try to maintain a consistent sleep schedule and use non-food coping strategies, such as walking, journaling, breathing exercises, prayer, or speaking with a therapist. You may also benefit from continued medical or nutritional follow-up after stopping. Maintenance is an active phase of treatment. It deserves just as much support as the weight loss phase. Now let's address the taper question. Does Ozempic need to be gradually reduced, or can it be stopped suddenly? Semaglutide generally does not require a taper to prevent dangerous withdrawal symptoms. Because it has a long half-life, the medication naturally leaves the body gradually over several weeks. However, some clinicians may reduce the dose slowly or increase the time between doses while monitoring hunger, weight, and blood sugar. The idea is that a slower transition may give the patient more time to strengthen habits and notice early warning signs. However, strong clinical evidence proving that tapering prevents long-term weight regain is still limited. Do not create your own tapering schedule without medical guidance. Changing the dose or timing may affect blood sugar control and may not be appropriate for you. There are also situations where stopping Ozempic makes sense. You may need to stop because of pregnancy planning, serious side effects, persistent vomiting, dehydration, poor nutrition, or another medical condition. You may also decide that the cost, side effects, or treatment burden outweigh the benefits. Continuing Ozempic is not automatically right for everyone. Stopping it is not automatically wrong. The decision should be based on your health, preferences, risks, and available alternatives. If you are considering stopping, create an exit plan before your final injection. Discuss why you are stopping with your provider. Review your weight, blood pressure, glucose, and recent laboratory results. Decide how your blood sugar will be monitored and whether another medication will replace Ozempic. Create a meal plan built around protein and fiber. Continue resistance training. Choose a realistic method for tracking your weight and appetite. Schedule follow-up appointments instead of waiting until problems develop. And decide in advance what amount of weight regain or rise in blood sugar would prompt you to contact your provider. You do not need to wait until you have regained all the weight before asking for help. Stopping Ozempic can lead to increased hunger, rising blood sugar, and partial weight regain. Research shows that these changes are common, but your personal outcome is not predetermined. Most importantly, do not treat weight regain as a moral failure. Body weight is influenced by biology, medication, environment, sleep, stress, medical conditions, and many other factors. Whether you continue Ozempic, switch treatments, or stop medication entirely, you deserve care that is supportive, informed, and free of judgment. Subscribe to the GLP-1 Nurse for balanced, evidence-based information about Ozempic, Wegovy, Mounjaro, Zepbound, and life during and after GLP-1 treatment. And if you are preparing to come off a GLP-1 medication, download the GLP-1 Exit Strategy Guide using the link in the description. It includes practical tools to help you plan meals, protect muscle, track appetite changes, and prepare for conversations with your healthcare provider. Stopping a medication is not the end of your health journey. It is a transition, and with the right plan and support, you can move through that transition with greater confidence.